Hello, my name is Dr. Andrew Oteo, and welcome to the Graduate Business Capstone presentation of Stonebridge Health. We'll talk about the organization, discuss a little bit about the history of the organization and some of the current challenges that the organization is facing as we're growing into 2023 and beyond. But this is the current organization. It's located in the Colony, Texas. This is not a franchise. It's been around since 2016. So we just celebrated 7 years in business. And really the mission and the goal of our organization is to partner with our patients and help them live a better quality life. Over the years, we've integrated and brought in different services. As you can see, there's physical therapy, medical services, as well as chiropractic, with the office initially beginning as a chiropractic-only practice and then branching out to offering other services over time, which has created many opportunities for the group, but also has led to different challenges and different pivots along the way. This is one of the things that we focus on with our team. The mission of Stonebridge Health is to provide the members of our community with high-quality, affordable health care in a comfortable and uplifting, family-oriented environment. The mission, goal, purpose, vision statements have changed over time, but they've all helped to embody what the purpose is of the organization. And one of our organization mantras is less pain, more gain. We're trying to create more impact on our community. And as you can see, as a result of that, there's been more impact financially for the organization. So we'll break this down into the performance of chiropractic, physical therapy, and medical. As you can see, there's been a very healthy growth phase from 2016 to 2022, with over a 690% growth over the past 6 years within that. So very healthy patterns that we're seeing. And currently for the last year, we had a 19% growth compared to the previous year. So very, very healthy with that. Physical therapy has had an incredible growth pattern as well. From 2019 to 2022, they've seen a 543% growth rate, which has been great, but scaling that has also offered its own set of challenges and problems along the way. And then most recently, we did bring in we brought in medical services, which has seen a growth pattern of 736%, which is something that we're also focused on growing over this coming year. Through this, we constantly are looking at SWOT analysis and trying to resolve issues within the office, but we're going to really discuss some of the problems that we've identified and including some of the financial impacts that we've seen with this. So the first challenge that we have is medical integration and billing practices. So going from a chiropractic physical therapy only, and then into a medical organization, there's been a lot of challenges along the way. Lost revenue has been one of those things too, of trying to figure things out and having the right consultants to help us with that. Avoiding certain fines and penalties that there are, but there's also a great deal of expenses that have to be output in order to put a legal structure like this in place with our business. They're also having medical services put you at an increased audit risk. There's more red flags in terms of billing and considerations that we have to have with a legal framework from going to an S corp to a partnership. And then, of course, the consideration we have with billing practices is always patient satisfaction. If we do have improper billing practices, that's something that patients do not like to see on their EOBs when they get those in the mail, and that's something that we have to be consciously aware about. And then the legal liability behind any kind of issues within medical integration and billing practices that we have could have a massive financial impact on the organization. The other challenge we've identified is anti-kickback and legal corporate protection. Obviously, going through some of the stories of anti-kickback of organizations, soliciting or enticing other organizations through financial means, through trips, through presents and gifting. We really identified some areas that we have been much better with. Of course, gifting, like bringing cookie baskets and stuff like that, even that could be in some way enticement or kickback. So we've been more conscious about that. Civil and criminal penalties are definitely one of the cons of that we have to be constantly aware about, that there's penalties associated with those. Reputation damage. In some of these situations, we've seen different business organizations having issues within that, which could potentially have a massive impact financially, but also from a public standpoint perspective of their brand identity. Exclusion from government programs like Medicare, Medicaid, federal Blue Cross Blue Shield, federal plans. Any implications within those could be massively damaging for the bottom line of an organization. Whistleblower lawsuits. There's people within an organization that sometimes can, distribute information for either, out of malice, out of just spite, or out of possible additional financial gain in some way. So understanding that there's a balance that has to happen within that, and not having reciprocity towards people that may be considered a whistleblower within an organization. And then, of course, loss of corporate protection is a huge thing that we're constantly looking at protecting. Documentation is obviously something that every organization can do better, but reduced reimbursement, increased risk of audit, legal liability within that, of not having properly timed documentation practices, delay in payments. That's one of the things that we are trying to make sure that we're keeping consistent with the reimbursement of our practice to keep things afloat. Decreased productivity, and then increased administrative costs associated with documentation practice that may be improper or delayed. We do have a very extensive SWOT analysis with tables included. What we did is, just to kind of go through this, obviously a SWOT stands for strengths, weaknesses, opportunities for improvements, and threats. But what we did is we broke down each organization or each group within our organization. So we do have a chiropractic SWOT analysis. We have a physical therapy SWOT analysis from our physical therapy team. We also went through our medical organization and broke down some of the challenges that we're having within that group. And then broke down on here, you can see the chiropractic SWOT analysis. The bottom line with most of these SWOTs, and just to kind of go back through this, you'll see that strengths are a rapport with the patients. Like, we have excellent bedside manner, excellent ways that we're able to communicate with our patients. One of the weaknesses we have is, just with some of those challenges, documentation, protocols and procedures, making sure that we essentially consider our small business on the same par as a large organization or even a franchise, to consider growth for the future and make sure that we're putting the proper SOPs in place to create a framework and a foundation that will help to scale in the future, whether we decide to stay within our four walls or whether we expand our practice into other locations. So that's our main consideration within that. Investigative procedures that we took into our format. Number one is, this is kind of the bottom line with what we consider. The organization holds three core metrics of growth. Number one has to be patient experience and value. Number one is patient-centric. Number two is compliance, and thinking about ways that we can protect our organization more closely. And then number three, in this order, is profitability. We do not put profitability first. We always put our patients first. And as a result, that's how we have come up with different consultants and metrics to help us along the way. This gentleman is Dr. Frank Corbo. He's been instrumental in helping us with the administrative side, the business side, the future growth, and kind of future pacing where our organization is heading into the future. So he's been a massive resource for us. This is David Klein. So he's been very good with helping us on the side of compliance in terms of billing, coding procedurally, and helping us to stay basically safe as our compliance officer. Josh Massengill is our attorney, and he has been a massive resource for us in helping us structure the proper framework for growth for the future for our organization. And this is our current leadership team. That's me in the center, and then we have our different doctors and administrative professionals here in the office. We do have some pretty massive proposed strategies. I put this frog up here because one of our concepts is eat that frog. And there's many things that as an organization sometimes we have trouble with. And so our focus and our goal right now is to make sure that we are looking at these things through an objective lens and uncovering these things together. Medical integration and billing practices. These are our list of different things of going through our EHR system, regular review and updates of billing procedures, training the staff on billing and coding procedures, excellent, strong communication with insurance companies, and technology solutions that will help us with billing and avoiding audits and proper billing practices. With our anti-kickback and legal corporate protection, obviously compliance is key. Doing our due diligence, monitoring these transactions, and maintaining proper documentation and paper flow throughout this is an essential part of that, as well as encourage reporting from within the organization and from those 1099 and other consultants from outside of the organization. And of course, partnering with Josh Massengill, our legal counsel, is a huge part of this. And documentation, practice, and opportunities for the future of, being consistent and accurate, timeliness, clarity, relevance. I mean, all these different things that are case value drivers within the documentation of our organization is huge. Legal compliance, use of standardized terminology, make sure that we're collaborating when necessary with different technology and thinking forward through the future of creating regular reviews on these. How do we evaluate outcomes? We do have, and previously we mentioned some SMART goals that are associated with our SWOT analysis. And so we went through each one of these and created some SMART goals that we're going to be focusing on. With our medical integration and billing practices, establish a regular audit review process to ensure proper billing. All billing and will be they'll be doing a training program to make sure over the next 3 months that everybody's on par with that, and establish a really solid compliance committee within the next 3 months as well. We'd like to reduce our billing errors by 50% within the next 6 months, and that's what that compliance committee will also be focused on. And implementation of new billing software system within the next 3 to 9 months. Anti-kickback and legal corporate protection. Establishing a comprehensive anti-kickback committee will be an essential part of that to keep and make sure that we're editing and looking at what we're doing from an internal standpoint by auditing ourselves within the next 3 months. So that way, in the event of an external audit, we're well prepared, we have things documented, and it can show that we are making proper progress towards the future, and really make sure that we have a really legal compliant program within the next 12 months would be an essential part of our goals. Documentation practices is key. We have appointed a committee right now of chiropractic, physical therapy, and medical professionals. So every brand within our organization is represented with this EHR system. One of the things we are looking at right now is whether our EHR system will be future-proof for us or not. So over the next few months, we are going to be looking in to see if we need to make any kind of a pivot now rather than later. And then optimizing the data entry method of macros within the current EHR system within the next 6 months is going to be a really essential part for us to have more of a streamlined paper flow and make sure that we're able to do things more effectively, because we want to make sure that with our documentation, increasing the accuracy to make sure that majority of patients are within that system in a relatively short period of time. And then, of course, opportunities for the future. We want to create more of a research and development committee. One of the things that we do feel will be an opportunity for us is telemedicine within the future. We want to look and see if we can grow that within the next calendar year, and while doing that, increase our total revenue by 20% within the first year by offering this new line of service that we feel will be something that more patients will want. We've already had more patients asking for it. Financial analysis and expectations of the new plan. The beautiful part is there's a blue ocean in front of us. There's a lot of opportunity that we see and are trying to capitalize on right now. Expectations, developing and empowering our workforce, making sure we're providing the resources and training. Culture is an essential part of what has made our practice special to our patients, and also why, a lot of our team enjoys coming to work. We enjoy collaborating with each other because we truly all want to get better in every way. It really comes down to enhancing the patient experience. We are here to serve our patients and serve each other. Another focus for me as the business owner would be to reduce cost and increase our profitability within the next calendar year. And that's something that we've had a lot of expenses with different things like that. We're kind of coming to a head with that. So things are going to be leveling out to where we will have more profitability within the next 12 months. And truly building trust and loyalty, we try to make sure we're doing the right thing for our patients. As we mentioned, the top 3 core things. Number 1 is patient-centric and adding more value for our patients. Leveraging technology, working smarter, not harder. Strong leadership and collaboration, which our leadership team is second to none. Develop in partnership with all stakeholders, everybody within the office, and we consider our patients stakeholders in the decisions that we make. And then, of course, having these regular monitor ways that we can check progress and have these SMART goals that'll help further our SWOT analysis. This is John Wooden. He is one of the gentlemen that has been instrumental. He is no longer with us, but he has been instrumental with this pyramid of success. This is just one of the foundational premises that we share with our team and that we help to grow each member within our team. So I wanted to put that on there because it is such a key and critical part of how our office has had so much success over the years. And this is our dream team. This is the entire Stonebridge team. I really thank you for your time. Thank you for joining us and learning a little bit more about Stonebridge Health in the Colony, Texas. Through these challenges, through these different struggles, we have grown so much. And this past 7 years have been incredible. And we look forward to many, many more years of serving our community through loving service and through quality healthcare. Thank you so much.